Hi everyone, my name is Navneet Bains and I have developed this infographic as part of PIDP 3351 as my strategy to move students towards becoming more self-directed learners. So this is my assessment of for as learning infographic. So what I would do is present this infographic to students and show them the differences between the three different types of assessments. Assessment of learning, I feel that they are used to because they do have to have some sort of a summative assessment as part of the curriculum and provincial standards. I teach nursing students at VCC, so we can't really get out of a summative assessment for students. So I would kind of show them the difference between that, which they know, they're used to. So, grading a paper, an exam, final evaluation in the clinical setting. Telling the difference assessment for learning. This is kind of your non-grading assessment. It can be a formative assessment, and it helps students kind of understand their what they need to learn and help them understand sort of concepts, kind of see where they're at, and it doesn't provide them a grade. So this could be kind of like a midterm evaluation that they get done in the clinical setting, just showing them kind of the examples. Receiving informal feedback after a skill that they may be performed, which I give them often. And then moving to assessment as learning, which is getting them to assess themselves, monitor their own learning, ask questions as needed, becoming self-directed learners, and having self-directed learning. I feel like for nursing students, this is especially important because as nurses, we should be continuously reflecting on our practice in hopes of becoming better nurses. So the strategy would also be kind of explaining to students, like, why do we want to develop into self-directed learners? Well, how do we do this? Or how is this done? So first of all, who is helping us towards this assessment as learning? So of course, just letting them understand it's yourself. So you're reflecting on your own practice, accepting feed forward from peers. What is it? What is assessment as learning? It's taking responsibility for your own learning, asking questions, modifying and improving yourselves, understanding that it's done continuously. Why do we need to do this? To help with your own understanding, figuring out how to learn. How is this going to be done? Well, accepting feed forward, reflecting on your actions, reflecting on your practice, and assessing yourself. So how I would get students to become self-directed learners is the strategies would be, for example, getting them to present case studies in front of their peers during post-conference that we do in the clinical setting, and accepting feed forward. So during these case studies, the students would present a patient that they have come across, that they've kind of seen, that they may have done things that they may not do in the future if they came across this patient. So they kind of work through this case study, kind of present it to students, and they reflect on how they presented themselves, and just to see kind of how they learned through it, reflecting on their own actions of when they were looking after this patient, what they found that they could improve on, so that the next time they encountered a patient with kind of the same diagnoses or how they would treat them. Helping them understand that you're assessing yourself, you're continuously self-reflecting, because you're finding ways to improve on your practice. And this can also be done by using ORID reflection. So if something occurred in the clinical setting and they weren't quite happy with what happened, getting them to reflect on that using ORID to kind of see how they can improve, because the whole purpose of this is to help them become better nurses, so that when they do eventually finish the program and they are practicing on their own, they're still doing this reflecting on situations when they come across patients. If something didn't go according to how they wanted it, thinking about it, reflecting on it, and thinking, how can I do things differently the next time it happened? Because ultimately, it's going to benefit the patient. So this is kind of the way that I would present this to students to help them become self-directed learners. Thank you. And I would appreciate any feed forward towards this strategy that I have developed. Thank you.